It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And we've got a great guest on today. She's only been a guest of ours for a few months, but has had a remarkable transformation. And I know Dr. Hotze is looking forward to sharing her story. Dr. Hotze.
Thank you, Stacey, and thank each one of you for joining us today on Dr. Hotze's Wellness Revolution. I believe that you and everybody really needs a physician and a staff of professionals who can coach you on a path of health and wellness naturally. So as you mature, you've got life, you've got energy, and you've got enthusiasm. That's the important thing. Energy, life, and enthusiasm. And that's what we want to help you do. So we have a simple program, and that's done without pharmaceutical drugs. So we have a simple program that we encourage our guests to follow. And today I'm pleased to have Madelyn Garza, who's been a guest only for a very short time, since July of this year. So she's been a guest for about 3 or 4 months right now. And she has a very interesting story. So, Madelyn, why don't you just tell us about your health journey? I know you had problems 10 years ago. Why don't we start back there? How many children do you have, by the way?
I have 2 sons and a daughter.
Okay. And tell me what kind of work you've been in during your life, besides the work of raising a husband and raising 3 kids.
Oh, I mean, just work-wise, I did work for Enron at one time. From there, I went over to work at St. Thomas High School. And then from there, I took a little break, and then I started back there again, and now I'm home.
Good. So tell us about your health. Are you from here in town, by the way?
I'm a native Houstonian.
Really? Where'd you go to high school?
I went to Reagan High School.
Did you really?
And I grew up in the Heights. My dad went to Reagan High School. We all grew up in the Heights.
Is that something? Yeah. That's something. My son lives over there now in the Heights.
Yes, my mom and dad still live there.
So got married, had 3 kids, and then about 10 or 12 years ago, you started to have some health issues. What happened? Well,
before that, I was having very heavy periods, just very heavy and very painful, and they were very long.
And you would have been how old at that time?
About 47.
Okay.
In 2009, and then I went in to see my OB-GYN, and she had done an endometrial ablation, and that was all that she did. She put me on some estrogen and progesterone. Then that following year, I was diagnosed with breast cancer. So stage 3, which metastasized to my lymph nodes and was ER positive. And they started me on tamoxifen right away. So. Now,
tamoxifen is a chemotherapeutic drug that stops the production of any estrogen in the body and binds the estrogen receptors, which in itself has a host of side effects. But the whole concept is, if you're estrogen sensitive, that the idea is to stop any estrogen from affecting breast cancer in an adverse way.
Right.
So you started on the tamoxifen. How'd you do on the tamoxifen? How'd you feel?
Not good. It puts you into automatic menopause. Just did not feel good.
And I might add, you mentioned that as you were maturing into your 40s, your periods started to get heavier with clotting and all that, and that's a classical feature of estrogen dominance. Almost every woman will experience this to one degree or another. The estrogen becomes out of balance with the progesterone. That's the yin and yang, so to speak, of the hormones. You make estrogen all month long, and then in mid-cycle when you ovulate, if you do ovulate, you make progesterone that balances the estrogen. Estrogen proliferates the inner lining of the womb. Progesterone matures it, waiting for a pregnancy. But if you don't make any progesterone and you don't, by not ovulating in a month, during the month, as happens to women as they move between 38 and 50, they start having anovulatory cycles, so they don't ovulate. They don't make any progesterone, and all you have is the proliferative effect of the estrogen. And so the periods will become heavier, They'll go from 3 to 5 days, mild, 5 to 7 days, moderate, 7 to 9 days. They get clotting, and then you get intermenstrual bleeding and cramping and mood swings and fluid retention, and weight gain, and headaches, and all these things happen.
That's right.
And it's because your hormones are out of balance, and they can be easily balanced with natural progesterone early on. So it's thought that the estrogen dominance has an adverse effect on the production, causing women to produce breast cancer. It's because they have their estrogen and progesterone out of balance. There was a study done in Johns Hopkins University School of Epidemiology that showed that women that had the lowest levels of estrogen had 1,000 times increase of all cancers, a 600% increase in breast cancer. So it's when women have this imbalance in their hormones that they are more susceptible to developing cancer of the breast. So anyway, you ended up having surgery, then put on tamoxifen, and that blocks the estrogen.
Right.
So what were some of the symptoms that you were experiencing for which you saw I'm sure you saw your OB-GYN and some other doctors about this. What kind of symptoms were you experiencing?
Well, and then didn't go away afterwards, but just very tired, extreme tired, very anxious and jittery, brain fog, no focus, feeling down and depressed. My hair was falling out. It felt very thin and dry. Muscle atrophies, moodiness, just irritable, just all kinds. I mean, just mainly emotionally, it hit me. Urethral incontinence. I had muscle atrophy. I had vaginal atrophy, severe vaginal atrophy. My bones and joints hurt, and then my knees especially, which they found after I was off chemo, because it started with chemo, but after I got off chemo, they said my knees were bone on bone after I got off. So it's just I didn't feel good. It's just I had a lot of symptoms.
And so you saw your oncologist and talked to him about that, and you talked to your OB-GYN doctor, and you saw some other physicians. What did they tell you, and what did they recommend?
Well, at the beginning, it was either antidepressants or anti-anxiety, which I didn't want to do because I had heard from other women, breast cancer survivors, that were on that, and it didn't help much, and then or it would make things worse, and then they had a hard time getting off of it. So I said no. I just said okay, and then from then on, I never ever said what my symptoms were. I never told them because I knew that it was going to be. I remember another time I talked about my hot flashes because I would feel like I was burning up at night, and they said, "Okay, well we can give you an antidepressant." And I said, "I said,
listen,
no.
This is what the common doctor does right now, the conventional doctor. When you have symptoms, multitude like Madelyn had, they just say, she's just depressed," as if all these symptoms were caused by low level of antidepressants or anti-anxiety or sleep medication. Nobody's sick because they have low levels of pharmaceutical drugs in their body. But this is the way the doctors are trained to think, we'll give a drug to solve the problem. Instead of addressing the problem upstream and solving the problem at its root, they try to mask the symptoms, which leads to a host of other side effects. And you were wise enough, Madelyn, not to take the bait.
Right.
But you still felt bad, and you told me your biggest problem was with the vaginal atrophy you had. What kind of problems did that cause?
Well, that was I could not. I mean, that was ongoing, and that would make me feel down because I was in pain 24 hours a day, 7 days a week, and it wouldn't go away. And so I would have to carry a bottle of water or like a small little container and refractionated coconut oil because that's the only thing that did not irritate me in that area. But I carried that and did water washes a lot. And then with my husband, we were not able to have intercourse for 5 years.
Now, why was that?
Because number one, it was painful. Number two, I would get a UTI immediately
That's
afterwards.
a urinary tract infection.
Where I was in the emergency room in excruciating pain and urinating blood. And it was just, and then I'd be put on antibiotics and then get a yeast infection. It was just one vicious cycle. And it was just to the point it was just too painful.
Right.
So
when you talk to and that's why you had to quit having relations with your husband because it caused you to get sick. So, and this is not an uncommon problem we see in women, and most people aren't going to be as frank as Madelyn has about her problem, but this was a big problem for her.
Yes, it was.
And she wanted to get it solved. So, of course, she went and saw her OB-GYN. What did the OB-GYN tell you?
Well, my OB-GYN is the one that put me on the water washes, ice packs, and refractionated coconut
Right.
oil. And then finally, my oncologist approved a estrogen cream. And but I started that, but then it irritated me. And then I saw a homeopathic doctor who gave me another cream, which did not bother me as much, but there was not much of an improvement. So I continued the other cream. I stopped the one that OB-GYN gave me, but then I started the other one. But there was not any much improvement.
Okay. So how did you end up deciding to come in? What made you decide to come to the Hotze Health and Wellness Center?
Well, I just wasn't feeling well, and it was just getting worse. So then the homeopathic doctor I was seeing at the time recommended I get bioidentical hormones. And then my husband said, okay. He says, he was a little nervous about it. He says, I really would feel comfortable if you got a second opinion, and I'd really like for you to go see Dr. Hotze because I've heard a lot about him. So to get a second opinion. So, excuse me, I went on ahead and did that, and things just started changing rapidly.
Okay, you saw Dr. Ellsworth when you came
Dr.
in.
Ellsworth.
Okay. Coming to our center, what difference did you know? Just walking into the center, coming upstairs to the reception room, how was that any different from any other medical facility you've been at?
It was just a blessing. I felt wonderful. Everybody, it's like they genuinely care about you. They listen to you. It was just wonderful. It was wonderful. I felt like a queen. I felt wonderful.
Well, we like everybody that's a guest of ours. We don't call our patients, we call them guests because, strangely enough, we got out of the medical practice in 1997 and decided to go in the hospitality industry, and within that context, provide medical care. So we call our patients guests, and what you name somebody is what you think about them. If you call somebody an idiot all the time, you're going to think they're an idiot. If you call them, boy, you're bright and intelligent, you're a really great articulate guy, well, guess what? That's the way you're going to see them. And if you think that about whatever you think about yourself. So we call our patients guests, and it changes the way we treat people just because the mind is a powerful thing. And when you have a guest in your home, you want everything to be nice. You want it to be nice accommodations. You want to provide nice refreshments. You want to have a smile on your face. You greet them and bring them into your home, and you want them to feel welcomed. You want to be hospitable. So they go, boy, those are the most hospitable people. They're so welcoming. I love being there. And that we wanted to create that environment because I happen to believe the way we treat our guests, like you, Madelyn, is as important, if not more important, than the treatment we prescribe. And that's very important. Yeah. But people want to be listened to. They want to be heard. They want to be understood. They want to be affirmed. And they want to be given hope that they can solve the problems. Most people, like Madelyn, had seen other physicians and just hadn't solve the problem because those doctors were all treating downstream. They were treating the symptoms rather than going upstream and treating the underlying cause of the problem. So we put you on some vaginal estrogen cream, put you on some progesterone, put you on some testosterone. We also put you on some a little bit of thyroid medication and got you on a good healthy eating program, got you on some vitamins and minerals. Okay. It's been 3 months. Has there been any change in 3 months?
Yes. Well, I started noticing right away. My mood was lifted. I felt, I felt wonderful. I didn't have the brain fog. I did not have the anxiousness that I was feeling. My hot flashes have really gone down considerably. I mean, just everything overall. And then what really surprised me, which happened very quickly, is my vaginal atrophy. Because here I was 2 years off of the aromatase inhibitor, and nothing seemed to be helping at all. I get on the estriol cream that Dr. Ellsworth prescribed, and the second week I started feeling a difference. Then I went for my annual checkup with my OB-GYN, and she said, your vaginal atrophy has improved. So I thought, oh my gosh. She says, I think you can start having intercourse with your husband again. But she wasn't very sure about the UTIs yet. But I can't believe within, 3 weeks, my vaginal atrophy had already improved. and that was real important for me.
Well,
So,
that is important. Now, you mentioned to her, and I'd like you to bring this out. When you told your doctor said, "Well, I guess the oil I gave you was working." And what'd you tell her?
I really didn't, because after that, I told her that I was coming to see Dr. Ellsworth with Hotze Wellness, and he had given me an estriol cream, and then after that, she didn't want to hear it. She did not like it that I was seeing an integrative doctor. She said she was not happy.
This is in fact, you kind of explained to her how she read you the riot act, and
Yes.
And how did you handle that?
I said a prayer while I was sitting there asking God, give me peace here, because she was not happy. It was difficult.
It's pretty bad when you go to your doctor and the doctor's talking to you in such a way you have to say, "Lord, please help me tolerate this," without blurting out anything I shouldn't say.
It was difficult.
So this is what we see with conventional doctors. They know nothing about natural approaches to health. They just don't. Why? Because they're not taught that way. And I had a professor of internal medicine, and when we used to give him answers, said, "You guys got it all wrong." He said, "You know what's wrong with you all? You don't like to think. And you know why you don't like to think?" This is Dr. Fred, God rest his soul. He said, "Because you're lazy and it's hard work." So I learned from him to ask why. Always question everything. When I had guests, before I call them guests, they were patients. When I had patients back in the old days, before I did natural bioidentical hormones, they had all these problems. I was treating for allergies. I was just going to take care of their allergy problem. They had all these problems going on, and I kept asking why, what's going on? And that's when I learned about natural thyroid hormone supplementation, and that's when I learned about natural female hormone replacement and male hormone replacement. And what a difference that has made in the lives of our guests over the last 31 years. It's amazing. We've had 33,000 guests come through. Does everyone do well? No. You know why? A lot of them they pay money to come in and get on the program, and a certain percent, 5 or 10%, just go like, "I don't want to do it. I can't follow the recommendations." Or maybe they get home and their husband goes, "Oh, you've been to 10 doctors already. You went to another one and spent a fortune. You're never going to get well. That doctor was right. You're crazy as a bed bug." And so you're not getting support at home. And that's why the guests that we have tend to do the best are guests that have been referred by somebody else who's done extremely well, because they have some support, and that's very important.
Yes.
But we're here to support you. We're here to have your back. We view ourselves as health coaches. You're the health athlete.
Yes.
We wanted you to get in the Health Olympics. Yes. You were in the Health Olympics. We wanted you to get a gold medal in the Health Olympics. You've been on the program 3 months now.
Right.
And I've looked at some additional things we can do to even get you to the next level. But in 3 months, you've really made remarkable progress.
Yes. I feel wonderful. And the thing is, I can call here anytime, and no one gets irritated because I ask a lot of questions. So that everyone's been very patient, very kind, and just wonderful.
Well, I want to congratulate Madelyn. Madelyn, I congratulate you because you took charge of your health. That's the most important thing you can do, is you got to realize your health belongs to nobody else but you. Mm-hmm. You can decide if you want to be healthy or not. And, with all the stuff going on and people worried about infectious diseases and viruses and all that, instead of being reactive, I'm going to wear a mask, I'm going to social distance, I'm not going to go out anywhere. Why don't you just build up your system, get your immune system healthy? Why don't you get on good vitamins and minerals and nutrients? We have a Dr. Hotze Immune Pack that we recommend, and all our guests are taking vitamins and minerals. I do too. I've treated a number of people that had symptoms of viral illnesses, may have had coronavirus. But you know what? I've been around them. Look, for 44 years I've been in medicine. Mm-hmm. I've seen people with viral, and when I did emergency medicine for 6 years. So I saw people with viral and bacterial meningitis, viral and bacterial pneumonia, viral and bacterial gastrointestinal disorders, strep infections, staph infections all over the body, boils, cysts, Pseudomonas infections in the lungs, and tuberculosis. I never, for one day in the emergency room or in my office, ever wore a mask. I never quarantined myself. I went home and I didn't quarantine my family. Nobody in my family ever got any of those illnesses. I didn't either. Now, how is it that some virus that they think comes from China is the worst thing since the bubonic plague? It's ridiculous. And it's ridiculous because you can be healthy and your immune system's meant to fight off viruses and bacteria. By the way, every one of you, and there's some germaphobes out there that are listening to this, and you're not going to want to hear it. You are covered with 1 trillion bacteria right now. Staph epidermis from the top of your head to the tip of your toe. It's all over your body. You can't wash it off with soap and water. In your mouth, in your sinuses, you've got viruses and bacteria by the billions and trillions. In your colon, you've got 4 to 5 pounds of bacteria in your colon. Why aren't you sick? Because you got an immune system. God gave you an immune system. And I heard some leftists say, oh, that stuff about the immune system is just a right-wing conspiracy. I want to go, you've got to be kidding me. There are books about immunology and the immune system, but they really believe, well, we can't really get well unless we get a vaccine. No, you can be well and you don't need a vaccine. You can be healthy and well. And if you get a viral illness, there's methods that can be treated naturally. And we've done that, and with some medication as well. Hydroxychloroquine, ivermectin. The president used Regeneron. Look at the president. Mm-hmm. They said he was going to die. Remember? Oh, my gosh, who's going to replace him as president? Will it be, is Pence going to get it? He's going to die, and then it'll be, and they were promoting Nancy Pelosi is going to be the president when they both die of this terrible cold. And the president had a fever for a day or two. They took him to the hospital precautionarily. I would not have gone if I were him. If he'd have been here, I'd have treated him at home like I do everybody else. Within 2 days, he was up in the hospital. He was up and out and doing fine. Held a rally this week. And they ought to be saying, see, you know what? Yes. Trump was right. Take your vitamins. And he was taking a lot of vitamin D, which is very important for the immune system. Vitamin D3, 5 to 10,000 international units a day is really critical to build up the immune system. They've done studies around the world. People with low levels of vitamin D are more susceptible to viral illnesses and respiratory viruses like flu and like the coronavirus if they have low levels of vitamin D. And believe it or not, most of us have low levels of vitamin D because we're inside all the time. I'm sitting in a room. I sit inside all day long. I'm not out in the sun. So I have to replenish my vitamin D. We test all our guests. Invariably, every one of them is at a low level. They need to be are in a low range of normal. You need to be up around 70 or above, 70 to 100. That would be nanograms per ml. That's where you need to be, and that can be tested easily. But you can safely take 5,000 international units of vitamin D3 every day. Take your vitamin C, take vitamin A, take B complex, take vitamin C, vitamin D. Make sure you take some zinc, and you can take probiotics, and you can take magnesium. Those are the keys to build up your immune system, and I want to highly recommend you doing that. And that's an aside from what Madelyn's been talking about, but it was a good segue. Yes. So what she has done, what Madelyn has done, is she took charge of her health. She knew the government wasn't in charge of her health. The insurance companies weren't in charge of her health. Her doctor wasn't in charge of her health. Her husband wasn't in charge of her health. Only Madelyn was in charge of her health, and when she decided to take action and to make a change instead of swimming, being downstream, drowning in a river, she went upstream, and she started to get at the root of the problem. And so in 3 months, she's really had a remarkable recovery. Does everybody have remarkable coverage in 3 months? Not necessarily. We have to adjust the hormones and the vitamins. Right. You got to get on a good, healthy eating program. Got to get on an exercise program. Got to get a good night's sleep. Got to get the stress out of your life. There are a lot of things that are components with feeling badly. But, Madelyn, you have done remarkably well.
Praise God.
I congratulate you.
Thank you.
And I appreciate the fact that you're an outspoken Christian and that you give God the glory. You wrote what you wrote us back on your answers to your questions about your faith in Christ, and I just think that's remarkable, and I think that's wonderful.
That's right. You got to keep your eyes on God.
Right. And, we have a choice in life. We can fear. All of us, now listen to me, should be fearful. The question is, of what should we be fearful? Should we be fearful of a man? Should we be fearful of viruses and bacteria? Or should we be fearful of God? In the fear of God, there's strong confidence. It says in the fear of God, there's life, there's vitality. Mm-hmm. He promises these things for those who will walk with him. So I want to encourage you, put your faith in God, and you don't have a spirit. You don't have a spirit of fear when you fear God and put your confidence in Him. You have power and love and a sound mind.
Right.
You can think clearly.
That's right.
Because you're not worried about what people are going to do to you, about what some virus might do to you. Just walk in faith rather than in fear, right?
Yes, I agree.
I should have been a preacher.
Yes.
Thank you guys for joining us today. It's been a privilege, and I thank you, Madelyn.
Thank
You're
you
dear.
so much.
You're a sweetheart. God bless you.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.